Should I press got it on here?
Yes.
Okay. So I want to welcome everybody here and for your interest about this very, very deeply personal and concerning issue and an opportunity. And I am the executive director of the Sunrise Center, and shortly I'll be introducing you to Floyd Taub, who's been a friend of mine for a long time, a cancer research physician and cancer survivor. And I have more to say in that moment. And I also want you to know I've had, my father started Cancer Research Institute, which is now nationwide on immunology. And then I started having my own experiences with people with cancer starting in 2010 with a woman with stage 4 breast cancer, mother of quadruplets. And then another person with stage 3 ovarian cancer, and another person with stage 4 squamous cell carcinoma, and then another person that Scott knows, which is Trevor, who had 4th stage metastatic melanoma. And I'm happy to say Scott is well alive, and so is Mary Andrews. So
is Trevor. You said
oh,
Scott.
I apologize.
Scott
Is still alive, definitely. And so is Trevor. Okay. So I'm very happy about that. So anyway, I'm going to let you know it was very, very deep kinds of experiences, and I became aware of different places, medical clinics in Mexico and things that are offered here, and also could see the emotional aspects of what American clinics are like when they interface with patients and the differences. And so with that, I just want to call you in the room for me. Thanks.
She'll get back in touch with you.
Oh, was that Emerald?
That is.
Okay.
I didn't know
thank
if he
you.
was trying to log on.
Oh,
So-
yeah. So this is Dr. Floyd Taub. We've known each other for about 20 years. And he is, as I said, a cancer research physician and a cancer survivor. He was actually the developer, really, of the PAP test, which has saved many women's lives from cervical cancer. I even knew someone who had cervical cancer who died of it. Okay, and this has saved it's saved more cancer lives, I think, than any. And he's also a cancer survivor himself, possibly of hairy cell leukemia, which is possibly related to glyphosate, which I also presented on in the the last series we did on Roundup and glyphosate. So anyway, I am very pleased that you're here, and you're going to talk about a very non-toxic drug you discovered in the course of working with cervical cancer, and the unfortunate way it got manipulated, and that we're about to try to create it again and support it again, and also something accepted by the Homeopathic Association in America for a version of it called Torox, which is very good for the immune system. So I really want to welcome you here, and I welcome all of you here too. And you may get very interested in joining us, and that will be possible on after this meeting, also on Monday. Also, if there becomes to be enough interest, we can create a special meeting on Torox and beta allothane. So with that, I want to introduce you.
Oh, thank you,
Right
Laura.
there. Thank you.
So
Okay.
nice of you.
All right,
Really
go for
appreciate
it. Okay. Thank you.
Thank you for that warm introduction. And Scott, thank you for making this happen and all your efforts here. And welcome, everyone. Thank you so much. It's really a pleasure to speak to you all. So, is my head cut off? I'm just slightly taller than Lori. So I'm really pleased to be here, to be involved in this discussion about expanding the number of treatments for cancer and welcoming alternative treatments, because it is clear that the current ones are problematic. Now, over 600,000 people a year die of cancer. Lori, thank you for mentioning my experience with the Pap smear and what I was involved in changing the traditional microscope-based Pap smear to using DNA. I'll talk more about DNA a little bit later. And we were the first group to really commercialize HPV testing for cervical cancer, which has become the worldwide standard, a little slower here in the US, but even now it's caught on here. My experience with HPV led me to conclude that the immune system was the most critical thing in whether someone got cancer or not. Because even if you have the most malignant type of HPV virus, the not vast majority, but about 2/3 of the people will cure themselves of the virus and never develop cancer. Of course, we treat it all so that no one develops cancer if they're properly screened, or it's very rare. Anyway, that experience led me in 1990 to begin a quest for immune-stimulating drugs. I found one at the University of New Mexico. And the first slide here, but in order to show a slide, can I grab the...
You're screen sharing.
I am screen sharing. Oh,
Yeah,
great.
just use your own computer and screen share.
Thank you. Grab slide here, if it just takes a second. We've got little
The sound is fine.
technical difficulties.
Sound is
Here, well.
There you go.
So the first slide I'd like to share shows a person who had cancer. In fact, he had 3 recurrences. This was his 3rd recurrence, and you can see this massive here, grapefruit-sized mass in this MRI. No, it didn't switch to what I'm showing. Thank you for letting me know. A little technical difficulties. Let's try this one. Okay, thank you. So you see here a big mass in this person's abdomen, going nearly from his backbone, from his aorta and vena cava, pushing up his belly. And as soon as he got on the drug, he said he felt better, and it progressively shrank over the course of the year. Excuse me? It's called beta-alanine. And this was the best experience of my life, to seeing dramatic results like this without toxicity. A few years later, I had the worst experience of my life, in that the medical community would not accept these dramatic results, didn't believe in it, and the drug got squashed. So I moved to make a chemical cousin of it, registered as a homeopathic drug because it was extremely potent. And now it has a similar amount of molecules, but also is potentized. And that's been used to treat fatigue of various types. And this slide shows people with Lyme disease who often have fatigue. And you can see half of them had about a 50% improvement. And another, over a third, had a dramatic improvement, 75 to 100%. So we're excited about the chemical cousin, but to return to cancer and DNA, I'm now working on a project that uses DNA in the bloodstream to determine if any cancer therapy is working, whether it's alternative or conventional. And to just show one quick slide on that, In the people who clinically responded, they're shown on the left slide over here. You can see that before their therapy, they had more cancer and a greater signal on our test than after the therapy. Well, the people who progressed, the opposite pattern, that before therapy, they had less cancer than afterwards. That's the definition of progression. And they had the signal on the test went up and indicated they have cancer. So those are the things that I've been involved in. It's really nice to be able to talk to you about that. And we'll see the slides, and we'll see the movie, a lot of different potential ways to treat cancer. Everyone is unique. And what we're focusing on now is testing each drug in that person to see if it is actually working. So we can get them off drugs that don't work and onto drugs that do. Okay. So without further ado, we can get into.
Lori, do you want to say anything about the movie before we show it?
Okay, well, Lori, will we get Lori for that? If anyone has a question now, we'd be glad to address it.
Maybe we can go ahead and show the movie right now. If need be. I didn't know if Lori wanted to introduce that.
You might be information in the movie, right?
Right, we'll watch the movie and we'll come back to many more questions.
Thank you.
For some reason, I've lost my cursor. I've had it the whole time.
I have a question. Are we doing questions or waiting?
So while Scott keys that up, if there are any questions or if anyone wants to share any of stories they know about
I
people's
have
cancer
something,
journey.
a question.
Yeah, Samantha.
That you're working on a test that'll tell if the treatment is successful. And what kind of test is it that you do?
So what we look at is the cancer DNA in the blood. So if someone has cancer, especially advanced stage, some of the DNA from the cancer escapes into the bloodstream. And we can measure that and see if it's going up or down. And that lets us determine if the therapy is working. So very often now, it takes 3 or 6 months before they can take a CAT scan or an MRI to really assess if the therapy is working. And with this, some of the patients on the slide I showed you were tested as early as 2 weeks.
How to know if you can ask the doctor for such, like there should be some symptoms.
What
So
we
they
believe,
covers
so I want to say this test is not available right now. We're just developing it. And it was first presented at the American Association of Cancer Research last week. And what we believe is in the future, someday, the same way whenever you visit the doctor if you have cancer, you get a white blood cell count and a chemistry to see if you can take the next therapy, the next month or infusion. We think at the same time, they should use this test to see if the last infusion worked. And why spend another $10,000 to $20,000 on immune therapy, for another infusion if the previous one didn't work? You'd be healthier if you get some other therapy. Because there's no way of exactly predicting who will respond to what therapy now. So this will help.
How about that test? Is it only for breast and ovarian? Can that be a BSRA or BCRA?
No, it's not restricted to any DNA mutation or anything. We've
BSRA.
right. So
So
So the question was, is it only work with cancers that have a DNA mutation? And the answer is no, it works with all the types of cancer that have been tested so far. In cell culture, that's a whole wide variety of them. In people so far, we've tested lymphoma and small cell lung cancer and colorectal cancer. So the three biggest ones, working down from the top, but that's where we started. And it's so we think it's going to be every visit to the oncologist. You say, yeah, doc, how am I doing? And right now, the doctor cannot say unless he's had a recent CAT scan, which are expensive, take another trip to a specialized institution. And, we want a test that the doctor can do in his own office to give you the answer. How are you doing? And if you're doing well, that, of course, encourages, the body-mind connection. And if you don't happen to be doing well on that therapy, get on one that you will be doing well.
Dr. Taub, is this
Scott,
test?
shall I answer more questions, or are you ready to share?
Every time I go to show the movie, it's causing my computer screen to freeze, and I've never experienced this before.
You on my computer?
Well, let me see if I'm gonna try one more time.
Okay, so any other questions meanwhile? Please
Yeah.
repeat the name of the test. The name
Is-
of the test is Therascape, but it's not, as I said, not available yet. The company is very young. We've just had a few private investors, and we're moving the technology forward. We hope it to be ready within the next year.
Is this like an
I
equivalent
say-
to the Greek test
I can
where
show a
it
bit
measures
more about that
circulating tumor
since-
cells?
We've had questions on it. I'll share my screen again.
Well,
The movie is
maybe.
started?
Not yet. Don't worry, not yet.
No, not
And
yet.
also, I want to say a few things before.
Yeah, no, and I still need to make sure that I can play properly because somehow it's messing up my computer.
Oh,
And you sure you don't want to use my computer?
Well,
It's also in.
Yeah, switching over, if need be, that's what we'll do.
Uh-huh.
You're using a map?
There
Yeah.
were some other online questions.
yes.
Then use the dongle.
I've got the dongle.
And if you disconnect screen sharing, I can show some more. And I'll look for the other online questions, which are covered by my screen.
One of them was, what is your opinion on the HPV vaccine?
So right. Everything has risks and benefits. And fortunately, with vaccines, we can quantify them because a very large number of people get them. And because everything does have, risks, there are some problems with every type of vaccine, but we can also quantify the benefit. And the HPV vaccine prevents genital warts, and it prevents infection with two of the most carcinogenic types of human papillomavirus, and it therefore prevents cancer. And it is a revolution in being the first vaccine that can prevent cancer, the first method that we can quantify the prevention of cancer. We do know that if you're healthier, you can keep your immune system in better shape, and that helps, but that's very hard to quantify. You can quantify a benefit from stopping smoking. So my opinion is that the benefits greatly outweigh the risks, but there are both in every situation.
Yes.
We do have a question from the audience. Andrew is asking, what's your opinion about the HPV vaccine?
Yeah, he's just talking about it.
Oh, okay, I was,
How long ago was it introduced? How many years already? Like collected experience people. Looking out, I didn't have it.
No,
20 years.
Yeah.
Yes, and they were, marketing to, children in.
Yeah, in other countries,
So-
They give it up to everybody. So
Yeah.
not just children, because it's shown, it reduced the risks so
yeah,
much.
it's like.
yeah,
You know, we've got 29 people watching, so if you guys are gonna talk, it's best to come so we can see
Sorry.
or respond or reflect back. I think
Yes, if about this vaccine, maybe people are interested, like, why was it decided to give like young people, young children? What specifics of it?
So vaccines tend to be more effective if they're given before you get the disease. They're good at,
For the dis-
right. So,
before you get infected.
and that's true of every vaccine
Yeah.
we have. You educate the immune system before it's exposed to the pathogen.
You know, was already.
That's right. It turns out HPVs are highly infectious. People generally pick them up in their teenage years and early in their teenage years, probably even without having intercourse. And so they introduced it to be given early to prevent that. And, there's some data now that it helps.
Can I say a few things?
Please.
Okay. So I just want to say that I got HPV 58, which is seen as connected with causing cervical cancer. So HPV 16 and 18, the Gardasil vaccination can arrest it, but there's a lot of HPV viruses, but my body got rid of it. And now I have a new partner, and I would not have any kind of intercourse with him or anything until I got him tested. And you can test for the genetic fragments from urine for men. And if you want to know the website that I used, it was IDNA. I do need answers. And so I felt a lot safer with that. And there are some risks, as you said, with the vaccine. And I am aware of a girl who got Guillain-Barré syndrome, and things can happen. And so you have to weigh the risks. But for myself, if I'm going to have a partner, testing them is what I like to do before I consider anything. And making sure I'm tested. Everybody's got their own little strategies, all right? So one of the things that also happened is that a person in our community, there's been an uptick, especially in men, in throat cancers, and a good portion of that from orally pleasuring women where they haven't checked the woman's status, HPV status. And I actually know someone who died, a man who was quite liberal sexually and died of that from orally pleasuring. The HP virus could go into the throat. So anyway, I'm all in favor of testing and knowing what we're doing.
Yes. So I'll come up to the microphone. If you don't want to be vaccinated or have your kids vaccinated, frequent testing.
Yeah.
Every couple of years will identify, a carcinogenic virus, and you
Both remember to be in front of so
Oh,
people can
goodness.
see you, because there's
Yes.
29 people.
Thank you.
Yeah.
Thank you. So totally agree. Testing is very important. Even if you've been vaccinated, testing is important.
Really,
Probably.
still important.
Well, as you point
Well,
out,
for
there
my,
are
my situation.
right. There are other types, and the other types will become more frequent because the vaccine is going to help wipe out
Mhm.
this 16 and
Mhm.
18.
And it can become a whole conversation about sexual behavior before one.
Only sexual, because I was
What?
asking, because I saw that it's the same papillomas which appear sometimes on the body, like is it different, like skin papilloma on other parts usually, or like sweat,
What is it?
underarms, or
Sure. Great question. The question is whether it's related to the skin papillomas that can occur or related to another similar questions. What about other wart viruses? The warts you get on your fingers or your feet or anything else.
Mhm. Good
And the
question.
papilloma viruses are very selective for where they'll grow. The ones that grow on your fingers will not grow on your feet. The ones that grow on your skin do not grow in the genitalia.
so there's kind of like vaccination, partial vaccinations in the body already.
Well, the virus,
Yeah.
it's like some plants require, acid soil and some require basic soil. The virus simply does not have an affinity for non-mucosal surfaces. But for mucosa, whether it's in your throat or your anus
Or your
or
vagina.
or this mucosal parts of the penis, those are all places the virus is happy to grow. In fact, it'll grow in most any area of the penis and a little bit away from the mucosa of the genitalia. But that's its home, and it's a different virus than the other ones.
Yes, and I want you to know, I see somebody's really appreciative what I mentioned about the test for HPV for men. It's actually very easy. It's just a urine sample. And you send it in, and then you get your results in about 2 weeks.
Yeah.
It's wonderful.
The problem with the tests for men is they are not as sensitive as the tests for women. So it's definitely a good thing to do, and it helps. But it doesn't mean the woman doesn't have to continue to be tested to make sure that she doesn't have a papillomavirus.
Right, and the man too,
Mhm.
but also it's your behavior. If you're just monogamous with somebody, you may have less to worry about. If you're being honest about it.
You may, but there can be hidden. In other words, you
Mhm.
could, your partner could have been tested and negative, but it could appear at a different
Mhm.
time. He was just
Okay.
negative at that time.
Okay, so I just wanted to say I'm going to show the movie.
Good.
And
Yay.
and the movie, the why I like the movie is because it really brings you in touch with patients and clinics. It's a little bit older, but we've done research on what's available now, and Floyd knows about other strategies with what's available now. There is a choice that happens, which is that what I found when I was looking at clinics today is that some of the strategies that they use in these clinics, which are in a few in the U.S., some in Mexico, and a lot of places in Europe, there's some uptake in alternative centers in the U.S. But unfortunately, mostly you don't get insurance payments for them. Now, I've considered, and Kathleen, you've mentioned, and maybe you want to come forward about the doctor being able to arrange with a medical bank. This is Kathleen.
Okay. Hello, I'm Kathleen Taub. Nice to meet you. No, I was just discussing, I've worked with some companies on the fintech, financial technology side of things. And different doctors can set up different ways to
Pay for
finance it, to
alternative
pay for all
treatments.
types of treatment,
Mhm.
with dental treatment, if it's, whatever treatment it is. And the doctor's office would set it up through the credit provider is what they would do.
Mhm.
So,
Mhm.
yes.
And it's good. And
Yeah.
you do obviously have to have a good credit record. But it's good. So with that, I'll let you watch this fabulous movie. And Burton Goldberg, unfortunately, is no longer alive. He died of a cardiac issue, but he was after going to all these clinics, it was Dr. Filiberto Munoz here, who is still operating his clinic in Tijuana, just across the border, that he felt was the best. But they're really all very good, okay? And they talk to each other. All right, so with that, take it away, Scott.
You're about to see a documentary on how integrative medicine reverses cancer. I'm a consultant and I'm available to guide you in the reversal of this dreaded disease. For many years, I was a businessman, a builder, developer, a restaurateur. I knew nothing about alternative medicine. My friend's daughter at the age of 19 slit her wrist. She was going to a psychiatrist and frankly being talked to death. It was a holistic physician in California who discovered she was hypoglycemic, a blood sugar imbalance. And when treated, she got well from mental illness. And that set me up on a journey to discover how alternative medicine can help with cancer, arthritis, heart disease, and other degenerative diseases. I've called this program Cancer Conquest, the best of both worlds, for not one system alone is as effective as using conventional and alternative medicine together.
You need to use the best of both worlds very frequently, and you just want to use the lightest dose of poison possible to get the job done.
I personally find that combining therapies is the most successful.
When they learn about the importance of mixing the both of the best of the both worlds, they are gonna do the best.
We do not see black and white. Neither conventional nor alternative medicine is the Bible. We have to use both of them.
And the best treatments that I have found so far were combination treatments from nutrients and nutrition and combining with the techniques that Dr. Scheller is applying.
What causes cancer? If you don't know the causes, how can you properly cure it? When we ask conventional medicine, they say, well, the sun and cigarette smoking, and we don't know. But our doctors know what causes cancer. Why do we have this Holocaust?
Well, quite frankly, there are many opinions, but I think the one that holds greatest sway in my experience is environmental toxicity. We've been exposed to hundreds of thousands of chemicals that haven't been on the planet before 100 years ago. And the body has decades and 25,000-year-old genetics, and the body doesn't really have a mechanism for getting rid of a lot of these chemicals and toxins and plastics and hydrocarbons and pesticides that we have in our body. It doesn't have a tool for doing this. And so that there comes an accumulation of these toxins. And when you have these toxins and they're manifold, it's well proven that 100% of us have styrene in our fat. 100% of us have phthalate.
That styrene comes from these coffee cups we use.
Coffee cups, packaging, wrap. Phthalate, PHTHLATE, phthalate.
Where does that come from?
A plasticizer. It's in the food wraps and plastic water bottles. That new car smell, that's phthalate.
Cancer is an epidemic, and it really ultimately boils down to a mixture of what's in the environment or what's not in the environment, what's in our food or not in our food, and genetics. But many, many women are coming in with breast cancer, many men nowadays as well with different cancers, with no family history of cancer. So it's obviously an environmental issue, and ultimately it needs to be dealt with in that way.
The main problem is that you have to look individually for the patients and figure out what can make this kind of tumor or why these patients had a tumor. So you have to look for the microenvironment, you have to look for the microchemie inside the patient. With this special kind of blood test, you have to check out the dental status, what the patient has, and you have to check out the energy level, on what energy level the patient is. So you have to look from different kind of aspects for the patient's health. And then you have to try to figure out what can help best to get the patient, for example, back to his good energy level, or to get rid of the factors which can cause cancer in his disease, for example, viruses or pollution or heavy metals. So you have normally to check all these things to treat the patient really in a good way, because otherwise, when you only destroy the cancer, it will come back, and this is for sure.
We have a lot of radioactive fallout. We have, and this is very important, viruses, a lot of viruses, pesticides and herbicides. They are xenoestrogens, and an overload in estrogens is resulting in not only breast cancer, but prostate cancer. It's also just bringing you out of equilibrium with your progesterone, testosterone, estrogen. If you are not in equilibrium there, then you are producing tumor.
Well, you and I know that there are many, many causes. There are lists of, I've drawn up lists myself of over 50 to 100 chemicals, genetic, environment, dietary, all of those things, poor lifestyle choices, smoking, drinking, diet. We know that smoking, drinking, diet alone probably 60% of cancers, I would say very conservatively. And then the others are environmental toxins, chemical toxins, viruses, parasites, various microorganisms such as mycoplasma, then all the chemical heavy metal toxins. We have a leukemic epidemic in Fallon, Nevada, where they have jet fuel leaking out of the lines that feed the Top Gun performers out at the Fallon Naval Base. And that JP-8 fuel is thought to be one of the causative agents of the leukemic epidemic. 16 cases of leukemia in a town of 25 to 30,000 people, when they should only have one case in every 5 to 7 years.
There are many, many causes of cancer, and it's a multifaceted activity that goes through years and years of changes in the body that affect the body's balance. Part of it is genetic, part of it is environmental, part of it is what we are eating or what we are exposed to. Are we involved in electromagnetic fields? Are we sitting in front of a computer all day long without protection? Are we eating properly or not eating properly? Do we have tremendous amounts of stress in our lives? There is a multitude of factors that play a role, many of which we can regulate ourselves.
Cancer is caused by DNA mutation, and what causes DNA mutation are so many subjects and objects and things that enter in our bodies. For example, mutating viruses, for example, the chemicals that we are loaded, unfortunately, in our environment with them, also the lifestyle changes and the way that we are eating, nutrition, all those will cause mutation as well as stresses, and every emotional trauma that we have received in our life. So all the long-term effects of whatever we have gone through our lives is gonna cause DNA mutation, and that mutation is when, if it is not dealt with a strong immune system, that is when it's going to end up in changing into tumor, and cancer is going to be produced.
15 years ago, my friend's mother had breast cancer to the bone. She had 3 to 4 months to live. She was in a wheelchair with excruciating pain. I recommended that she visit Dr. Munez in Tijuana, Mexico. Within 6 months, she was in remission. I would like to take you on a journey there now to see how he has advanced in the last 15 years because of his travels all over the world, picking up the most dynamic, effective treatments in the reversal of cancer. Why are you working in Mexico rather than in America?
I think a reason why these therapies cannot be put together in the United States is because the FDA is working with the big pharmaceuticals, you know, protecting them about the medicine they use. And whenever we have a treatment that is really working, but is not suitable to the pharmaceuticals, FDA just stop the use of this.
Tell us the kind of therapies you're using.
We use immune therapies, which are the use of substances, biological and synthetic, that will enhance the immune system and direct the response of our immune system to attack and destroy cancer cells. The dendritic cell is a very impressive vaccine, an autologous vaccine. Autologous means that we need to take blood sample from the patient, culture in the lab, and from there we administer to our patients. Dendritic cells are part of our immune system, but they are produced in a small amount, and they are kind of naive. You know, they do not really know what they are in the body. They don't know what its function is, even though they are produced in the body. Well, our work here is to culture these cells. From there, we train them outside of the body. We grow them, we mature them, and we train them to identify and attack the cancer cells in the patient. Okay, they go and tag the cancer cell, start to send signals to macrophages, to T cells, to natural killer cells, to come and help them to destroy the cancer cells. And it's amazing what happens. You can see in the microscope the activity of these cells. If you take a blood sample of a patient once you give the vaccine and start to track on those dendritic cells, you can see the activity. You can see how much they are working, you know, and results are, again, very impressive. Out of 20 patients, we have 19 patients responding excellently to this. We have at least 6 full remission patients, and the other 13, they are considered between stable condition to partial remission. The first thing that we see within the first 7 to 10 days after applying the dendritic cells, patients start to feel better. Symptoms start to be less aggressive. You know, pain starts to succeed, they start to eat better. For example, we had a patient with prostate cancer. His PSA to begin treatment was 800 with bone metastasis spreading to all the vertebrae, the ribs, the hips, the legs, and the gentleman was in severe pain. We did the treatment, the dendritic cells, and within a month, his PSA now is 0.89. Pain is completely gone. Bones can show 60% improvement from all the bone lesions.
The basic outcome of a cancer patient is not related to the clinical tumor mass, but it is rather related through very tiny amounts of cancer cells. They are called micrometastases that vagabond or are disseminated in the bloodstream. The entire wealth of literature worldwide tells the same story. Success of therapy, failure of therapy can be measured through genetic or genome analysis in disseminated cancer cells in the blood or the bone marrow. We follow by genes the drug pathways within a cell and detect by that approach whether a drug would work or has worked or not, or whether you have resistance factors. So we also detect resistance factors in these cancer cells.
So when Dr. Scheller sends his patient's blood to your laboratory, you tell him exactly which chemotherapeutic agent to use for that particular patient's cancer.
The blind therapies, as it is done worldwide, have, well, the FDA says in 80% that sort of drug is useless. We know from our enormous number of patients that from these 80%, another 60% are not only useless, but facilitate metastasis formation because the cells have gained resistance factors.
So the drug can cause cancer?
Oh yeah. Oh yeah, that has been known since decades. And we were the ones who identified these resistance factors in those cells that should be treated. And on the grounds of Kaplan-Meier diagrams, we found that many resistance factors can produce metastasis. So if you put all that together, the prediction value, that means will a drug work or not, at the moment is 81%, measured over all tumor entities that we have studied. That is a very high predictive value. It's much higher than you would obtain by doing the same sort of study within a clinical tumor. And the reason is disseminated cancer cells have a different makeup of genes than the clinical tumor would have.
So the tumor and the living cells that slough off the tumor need different treatments.
So we study in these cells what kind of DNA operations are there, and we study which kind of genes transcribe DNA into RNA. And we do that quantitatively in cancer cells versus benign cells. That's the whole story. And the outcome for patients is enormous.
And conventional medicine does not take this into account.
So the patient which has stage 1 or 2 cancer, it's not done when they are operated and then said, you are healthy, you can go. These patients think, oh, everything is okay, ready now. But this is not like it seems to be, because you have to check several things on these patients. And you know, they always say 5 years, when you have during 5 years nothing, you are healed. This is nonsense. You are not healed.
Every tumor spreads through the body.
Exactly this. So we have to check the patients regularly for the immune system and for the risk of spreading micrometastases.
I think that's the question a tumor patient wants to know, I'm cured or not. And so we know from our experience that tumor patient wants to know every half year, are there tumor cells in my blood or not.
I'm checking his blood every 6 months for cancer circulating tumor cells. The circulating tumor cells, I draw the blood, send it to Germany, and they give me numbers, and that way I have a benchmark to keep it in mind, and then in 6 months from here, before even PET scan shows any tumor, before even any CT scan shows anything, we are gonna know by just watching him periodically. If the number of circulating tumor cells are increasing, then it's gonna be a warning sign for us that I'm gonna tell him, go be checked because there might be something cooking in your body.
So I have had a change of heart. I mean, initially I would have never considered doing chemo or radiation in the conventional manner. But since the test has come along, the chemosensitivity test, I found that it's actually miraculous. They tested me the very first day I arrived at the clinic, and much to my surprise, the chemo that was proper for me was an ovarian cancer chemo.
Believe it or not.
Believe it or not. My PSA had gotten up to almost 900 before I left, and by the time I got to the clinic and they gave the very first test, it was 1160, which is certainly a very high marker. Now, the amazing thing, after staying the 3 weeks at this wonderful clinic, the PSA on returning home, and this is just after 3 weeks of treatment, was 49, and since then it's dropped to 13.
it's really great what happened in him, but only because of the combination of several treatments. So he had a combination of special kind of bone treatments like samarium, he had a tested chemotherapy, and he had an immunological treatment.
Here in San Diego Clinic, what we do is to send a blood sample to Germany, where they do a biosensitivity test, which is a blood test which they will help us to identify which is the chemotherapy that is very specific for that particular type of cancer in this particular patient. Why this kind of test is not available in the States, I have no idea. I do not know, but I know it's available in Germany, and it's very helpful. Since I began to use these studies in the last 5 years, I have noticed an improvement over 80% in my treatment before and after.
One of the most amazing stories Dr. Scheller and myself have in common was a successful treatment of a colorectal cancer with Herceptin. That was a patient who had metastasis from that primary tumor, and we did the routine assay which drug would work. And we found Herceptin would work. So the patient was treated with Herceptin, and all metastases had gone after some while. So what is behind that story? A drug does not ask the cancer cells, where are you stemming from? Are you a breast tumor cancer cell or colorectal or whatever? A drug would work if the cell, the target cell, the cancer cell, is susceptible. So that means pharmacogenomics in target cells. So Dr. Scheller and other colleagues treat their patients after pharmacogenomic results, regardless of what the tumor is.
And of course, that test is what ascertained that I needed an ovarian cancer chemo. I understand that in this country, a doctor can't give a prostate patient an ovarian cancer chemo. It's against the rules. You have to follow the cookbook, so to speak. And that's part of why we don't have the success.
What works on the primary tumor has not to work on the micrometastases. And also pathologists say this because the pathologists only see a little piece of the tumor or only a little piece of the body. And they cannot say exactly, they can exactly what kind of tumor is it, but they cannot say in the immunohistochemical way what is working or what is not working on this tumor. You can see it more exactly from the micrometastases because they are inside the body and they are all over the body. So you try to isolate from the micrometastases. And the problem is that when you have in front of you a healthy person, this means the patient is operated, he is separated from the tumor mass, what you can see, also what you can see in a PET scan, but you cannot exclude that this patient had micrometastasis inside, which has the risk for spreading.
And it can come back 1 year,
exactly,
6 months, or 15 years.
Dependent on the micrometastasis, is how much there remain inside and how aggressive they are. And you test this with a special molecular genetical program.
Professor, why don't more doctors use your system?
In Germany, I can give you a very concrete answer, that is money. A physician makes more money, the lousier the situation of the patient is.
Wow.
You know, he makes more money from a patient who is metastasized than before that.
Are you saying they don't really want to cure cancer?
I have seen many people belonging to that establishment, when they develop cancer, they come to my office and say, now you have to look into my disseminated cancer cells. Let the other patient be behind me. I have witnessed stories, if I tell them, they would be unbelievable. From politicians, from well-known journalists, all that sort of stuff.
Well, another great treatment that we have here is whole body hyperthermia. Hyperthermia is a treatment which increases the body temperature up to 103, 105 degrees, and it is well known and is established around the world by all the scientific research that cancer cells, they cannot survive. So hyperthermia can be used in conjunction with low-dose chemotherapy, IPT-based chemotherapy, and immune therapy. IPT chemotherapy is, for those that do not know it, is the use of insulin to lower the blood sugar in the patient's body, and in that way we stimulate the cancer cell to be hungry, because we know they eat sugar, they need sugar. So once we lower the blood sugar, we introduce the low-dose chemotherapy. It's a very fractionated dose, perhaps a 1/10, 1/7, 1/20th of a normal dose of chemotherapy in conjunction with sugar. But this goes directly to the cancer cells, so there is no side effects related with this therapy, and it's very effective. It goes directly to the cancer cells. So after IPT, we put our patients in the whole body hyperthermia, and we enhance. We have a synergistic effect. Using hyperthermia in conjunction with IPT, we have 14 times more benefits than using IPT alone.
In Frankfurt, Dr. Vogel, an oncologist, radiologist, and surgeon, who we'll see is inserting a catheter directly into the diseased organ for the application of localized chemotherapy.
For this interventional vascular oncology, we are performing two types of procedures. What you saw today is to insert a catheter in any type of vessel. You can imagine we insert ports for cerebral tumors, for lung tumors, for rectal tumors, for pelvic tumors. This is one step. So we are inserting the catheter there, and then we have the port.
I take it you insert the port for the local oncologist to apply the chemotherapy.
In my department, we're also performing the chemotherapy then. So we have our own beds and can care for those patients. As a second procedure, we also do perform chemoembolization, which means that we position a catheter in the tumor-bearing artery, and then that we directly apply the chemo drug, do a vascular occlusion, do a vascular shock for the tumor, and then remove everything. And our, let's say, our highest level procedure includes a vascular occlusion of a tumor vessel, application of a local chemotherapy, and this is followed then by laser-induced chemotherapy.
So the occlusion is done naturally with substances?
Naturally. We can do it naturally. We can do it with drugs, chemicals. We can do it also with coils, like I did it during that procedure, because it's very fast and very safe.
You did use a coil.
What we do, we first apply the chemotherapy, and then at the end, in the final stage, applying the chemotherapy, we do the vascular occlusion.
So you close down the blood supply to the tumor.
And then we have the drug in our territory of interest for about 5-6 hours. So this means a reduction of the systemic side effects. This is why so many patients are coming here, because patients with advanced cancer want to have a good life quality. And this is also part of our collaboration, Dr. Scheller and Dr. Jakob in the Leonardis Hospital and other hospitals that, at least in Europe and increasingly also in the US or in Japan or China or wherever, patients are more and more interested in having a good life quality if they cannot be cured.
This is a very important aspect in the treatment of cancer, mainly in patients who had several metastases, which cannot be operated, or sometimes it shouldn't be operated. For example, when you have a patient with isolated liver metastases, I would never operate this patient, because you make oxidative stress situation through the operation with the narcotics and all, and destroy the immune system totally. And after operation, it's well known that the tumor is spreading more aggressively in this organ which is operated. A very, very good possibility to treat such kind of patients is to make a local intervention with a chemoembolization or a perfusion of this organ, in cooperation with a systemic treatment and with a stabilizing of the immune system. system. This means that you give directly to the organs in low-dose chemotherapy to destroy only the tumors in this place and not to destroy the whole system.
The concentration of the chemotherapy in a locally applied therapeutic protocol is about 20 times higher than in the human body.
So it's 2,000 times more effective.
In a way, but it's important to know in what types of tumors you have to do that. So for example, if you have a breast cancer patient and the metastases are here, here and everywhere else, you have to carefully review whether this patient is a good candidate for a local therapy. This is always depending on life-threatening situations. So if the liver metastases are compressing the bile ducts, it's a life-threatening situation, then we perform these types of a treatment. Or if a human or a woman has only liver metastases, and then we would perform a local chemotherapy to decrease the tumors, to downsize the tumors, and this will be followed by laser-induced thermotherapy to completely destruct the tumor.
In Munich, we met Dr. Kubitschek.
Most important tool in the diagnosis of cavitation is this Italian-made CT scan. It allows us to make slices of 0.3 millimeter. That means more than the conventional CT scans can do. And with this machine, we find all the cavitational alterations of the bone structure. Without any X-ray diagnosis, we are not allowed to do surgery. I think that's the basic principle of medical.
So this X-ray machine, the patient is in there for how long?
70 seconds.
70 seconds and it's over.
And there's not almost the same, a little bit more radiation as a pano in a dentist.
I've never seen this device in a dental office in the U.S.
Meanwhile, they have the acceptance of the FDA, and I think there are 2 or 3 machines in the States now. Models. This one shows us how important the blood supply of all the teeth is. That are the maxillaris and the mandible veins and arteria. And you see every tooth has its blood supply, and this blood supply is disturbed the moment the tooth is dead.
And it's connected to the meridian system?
Meridian system, or
the nervous system?
Yeah. The nervous system we have here. You see all the things, and here you see all the Chinese meridians, and most of the meridians are running across the face and also in the depth, and show the importance of the connections. And this model shows the whole face is connected with nerve, and they are in contact with the muscles, and the muscles they are guided by the TMJ, and that's another import of information for the cancer patient, and that can disturb the whole system.
Is it true that every cancer patient should visit a biological dentist?
I think that's tremendous importance to have done this.
Dr. Rao in Switzerland says that 95% of all breast cancer patients have a dental involvement.
I can agree 100%. He's quite right. We found the same situation, and we even found several teeth that are characteristic for the breast cancer patients, and in special that are the premolars, the upper right 4 and 5 teeth on both sides. And a friend of mine, he examined known breast cancer patients at the university in Düsseldorf, and he found the same figure of more than 90% having root field or cystic premolars, and that's more than the average population has. That means there must be some connection between.
And yet conventional dentists don't look for this at all. And conventional oncologists pay no attention to dentistry. How important is dentistry?
Dentistry is very, very important. And the problem really is that at the university the dentists are not taught how important their job is in general. They learn a lot about being very perfect in doing root fillings, being perfect in doing fillings, and stability and aesthetic are the most important themes in the dental training. And they lose the contact to general medicine. And it was proven that before you start radio or chemotherapy, you have to clean up the mouth. And then 50 years ago, everybody was proud to have an alloy containing 10, 15, 20 metals. Meanwhile, we know it's better to have only one metal in the mouth. better no metal in the mouth.
And particularly nickel.
Nickel is a problem, vanadium is a problem, aluminium is a problem, iridium is a problem. Palladium is a real severe problem. In Germany we have at the moment increasing number of patients that have problem with palladium. It's a higher number of patients than mercury problems anymore. Palladium go to the brain and makes the people confused, depressive, and palladium is in most of the dental materials at the moment. The resin materials are a problem too. There is the plastics, the filling materials, and I think it's fair only to put material in the human body you know that the body will tolerate it. Of course, all the situation in the mouth loads the immune system, and you will not have any treatment of effective treatment of cancer without immune therapy, and you cannot do any immune therapy without taking care of the teeth.
I have one case here I could show you. That's a beginning bronchial cancer, and we just found a focalized dental problem.
Can we see that?
Yes, I could show you. This area, the whole, you see, he develops bronchial cancer on his left side. We know that already. The X-ray and CT and PET scan didn't show anything. But we know, and the patient knows, that he is going downhill. He had several pneumonias, but the left side here, it is originating here in the jaw dental area and is going all the way down. It is not on the right side. It is on the left side. That's a very important finding, and we have to do something about this.
It is the blood coming to the surface there that's creating the heat.
Yes.
And that's how he knows that.
Right. The more infection or inflammation, the more blood there is and the more heat there is.
So you'll see people that have a breast cancer. I'll see 85-year-old ladies with a breast cancer who've done nothing with it. It's kind of smoldered on for 20 years and gets a little weeping or a little blood every now and again. It doesn't cause a bit of problem. Old guys that have had prostate cancer for 20 years and a little bother with their urination, but not really much pain and not much bony destruction. And then there are people who have a breast cancer and a prostate cancer that'll go through them front to back to death in 6 months, and they're gone. Why is one so precipitous and another so smoldering? And I think a lot of this has to do with toxicity coming out of the teeth. And of course, it's we think mercury is highly related to, from the fillings. Remember, your silver fillings are 50% mercury, and they're outgassing all the time into your body. Even old fillings, even 25-year-old fillings are outgassing mercury into the body. And mercury is a very toxic substance that causes inflammation, and a lot of people think malignancy, as well as neurological damage.
This dentist at Georgetown University doing his master's told me that his father was called in to a young child with leukemia. They thought many years ago they didn't have the test for leukemia as we do now, but they assumed because she was dying it had to be a blood disease, and her gums were completely infected. And they called his father in to see what he could do to help the child, and he said, remove all the fillings. And they said, you're crazy, stupid dentist. What do you know? You're not a medical physician. He said, remove all the fillings, and told the father of the child this must be done. They did it, and the child got well and lived.
Yes.
So he found out many years ago, this was 25, 30 years ago, that he was doing his master's on this, and his father did this God knows how much longer in South America. So we know the toxicity, and we know now at FDA that the leaching out of substances, regardless, is a problem.
As part of our staff here in San Diego Clinic, we have our biological dentist who takes care of all these dental problems. It's well known that cancer is 50% or more related with our mouth health. We know from mercury fillings up to cavitations and root canals that are origin of many of our chronic health problems, including cancer. It has been proved that breast cancer is linked up to 95% with dental problems.
Early morning, Dr. Scheller and I flew to Berlin, rented a car, and visited the Charity University. I was not prepared for what I saw.
Well, I'm a biologist and not a medical, but here you see that a brain tumor patient, and this patient has been prepared already to has been applied the iron oxide containing nanoparticles.
So the surgeon inserted the catheter.
Yes.
You then put these small particles in through the catheter directly into the tumor.
Directly into the tumor by very conventional methods.
So that once you put these metal particles into the tumor, the patient will be on a gurney and be slid into the magnetic device, and then that magnetic device will do what?
The medical device generates a high AC magnetic field which changes its polarity 100,000 times per second, and by this very fast change of polarity the particles get heated, and the heat sum is very high, independence of mass, of little mass of iron oxide particles we have infiltrated into the tumor.
And therefore it kind of dissolves the tumor.
Yeah, so we have good data showing that our first in phase 1 study was for glioblastoma patients, which is a very aggressive tumor and all people die normally. We have seen that this therapy is very comfortable, that we have no side effects so far, and we have great temperatures in the tumor in the range of 50 degrees Celsius and more. And during this treatment, some of our patients fall even asleep, and we have to awake them after 1 hour, which is our treatment time.
And no pain.
No pain.
No burning,
no
heat.
burning. They had no headache. They had no bleeding or any other complications. And we can exactly steer the temperature in the tumor according to the demandments of the physician or the oncologist.
So you're absolutely vaporizing these brain tumors almost non-invasively.
Yes. It is,
that is astounding.
Independent, the only thing is to inject the particles in the tumor, and then the tumor is loaded up like a sponge with those particles, and the particles are taken up by the tumor cells, of millions of them. So, and the tumor cells are not able to get rid of these particles. Therefore, you can repeat the therapy as often as you want. We do it 10 times for some patients, or 5 to 6 times, and you have, again, only non-invasive treatments.
How long is the normal treatment? What's the time length?
The treatment time is 60 minutes, and it depends whether we make a hyperthermia approach, which with lower temperatures, so that we have to combine it then with radiation and chemotherapy to enhance the over efficacy of a combination of treatment then, to make the cells weaken towards the conventional chemotherapy, drugs or radiation. And we can also do thermoablation with the same approach, with the same depot of particles we have infiltrated in the tumor.
What does that mean,
Thermal ablation means that we use higher temperatures, which are effective alone already in the range of 50 to 70 degrees Celsius.
And so some patients don't need chemotherapy and don't need radiation. This can do it alone.
Yes.
But if they do, they could use lower dose, and this would become more effective because of this treatment.
Right.
Does this work on all tumors?
This is the most exciting thing, because it's comparable to radiation therapy. It can be adopted by a patented strategy, and by the nanoparticle coating we can adopt the particles to almost every type of solid tumor, and we have treated very different tumors already to get feasibility and toxicology and any other things with the therapy.
And your success rate is?
Well, the success rate is, we hope half of our patients are still alive. And according to the literature, with these very aggressive tumors which have obtained, or the patients obtained already radiation therapy, they were not re-resectable, they had already chemotherapy, and with all these patients with recurrent tumors, we have half of the patients still alive, and according to the literature, we would expect 3 months survival with those patients, and most of our patients are still alive.
Early diagnosis makes the chances of full remission far higher. A PET scan is an essential tool in the diagnosis of cancer.
The patient has the glucose inside. We have 1 hour from the injection to the examination time. And then he comes here inside, and we take him inside the machine, the PET machine. And it lasts, I think, about 1 hour and 10 minutes. The sugar is inside, the radioactivity is inside the patient. You have a tumor perhaps, and the glucose is coming inside the tumor, and the radiation is coming outside of the patient. And with these detectors inside the machine, you can detect all the radiations coming outside. And then we can make more pictures from the whole body, and you see where is fluorine and where is glucose, where is a tumor.
One of the therapies that we use in the clinic as complementary for our patients is the use of a low-level laser. Low-level laser helps to control pain. In this patient that has been chronically ill, using heavy analgesics to control pain like Vicodin, like morphine, we have seen our patients here that are using laser, the low-level laser, we can control the pain within 15-20 minutes. Our staff has been trained in that direction, and we can apply the laser, and within 20 minutes of therapy, sometimes once or twice a day, we can control very effectively chronic pain in our patients without the need of heavy analgesics.
In a small village in northern Germany, Dr. Kessler has trained a staff of 17 nurses and technicians to become what I consider the finest team of diagnosticians in the world.
We have a lot of heroic procedures today in cancer. You could fill up the bones with chemotherapy, for instance. You could instill iron oxide into the brain. But you still don't know why the patient has cancer. So in order to find out what the root cause is, we have to use functional medicine, which has been developed especially in Germany over the past 50 years.
What does that mean, functional medicine?
Functional medicine is involving the time factor. Other than conventional medicine, you would find out how the organ works.
When a patient comes to you, what is the process going through your clinic?
Well, first of all, we do a physical, and usually we have to do a physical. We check the lymph nodes and heartbeat, whether there is a pulse missing, whether you have a pulse deficit, do an ultrasound. This is the kidney, and ausatmen, and that's the gallbladder. Deep einatmen. Stop. The gallbladder has no stones there. That's the gallbladder here. Exhale. And that's the prostate coming up here.
And then all of this is recorded for you in your file.
Yes.
As to what exists at this time.
Yes. And then we do a thermography. Thermography is clearly showing differences in the right and left side, especially in beginning breast cancer. 7 years ahead you could see these two. We have here in the left breast here, we have this focus here in the upper quadrant here, and you don't have this here. I give you another picture of it. That is a pre-malignancy, the clear pre-malignancy. It's coming up here. It's very clearly here. It is not over here. It is not here in the right breast. It is only in the left breast. The thermogram tells you at a very, very early stage that there's something going on. Plus, when you start treating, you could see how that changes to the worse or to the better. The mammogram, to me, compared to the thermogram, is like watching the moon through a binocular. So it's, that's about how I feel it. It doesn't tell you where you are. It doesn't tell you the difference of the right and left side, except there is a major thing going on there. And it doesn't tell you how you treat, whether you are able to eliminate the early changes of the tissue. The more often you take a mammogram, the higher the risk that you actually produce cancer.
What are you looking for, doctor, in the eye?
I'm looking for constitutional factors. Each organ is relating to a special site in the iris. And When we checked the iris, we could find pigments or weak spots in the iris that give us hints where to treat and what to treat. Some substance missing of the iris. That is a clear sign of a beginning pancreas cancer or already a pancreas cancer here. We are looking for these deep holes. This is another sign here. That is a carcinoma of the bile system. There is a closed duct, closed up, plugged up by cancer. You see the deep sign in this area here, and you see the pigment in that area, and you have a reflex vessel here. That is a pigment of the pancreas projected on the kidney. So I have a causal chain. I have to treat the pancreas in order to get to the kidney. I could deduct that from the iridology.
But the wonderful thing is that you use this as one tool.
Yes.
You don't rely on it alone. You have 7 or 8 or 9 or 10 different tests to vector in and find the patient's problem.
The whole idea is that alternative medicine must be standardized. It's very difficult to standardize it, but if you put several systems against each other, then you get a clear picture what you're dealing with. And after that, we go to electrodermal screening. We use the acupuncture point as an information center. We not only find out which organ is diseased, but we also find out the causal chain, which organ has passed the hot potato to the other organ. So not until you know the causal chain, you will be successful. See, we are testing here over 40,000 toxic substances, including pesticides and herbicides and viruses, bacteria, environmental toxins, all kinds of environmental toxins. And it's the combination of toxins which is so dangerous. A very harmless virus all of a sudden could be very toxic if it's combined with PCB, atrazine, and a certain radioactive element, for instance. We have several systems that we hold against each other.
So when you do this electric dermal screening, how can you tell by putting a probe on an acupuncture point what's going on? How does that work?
It is a resonance procedure. If you are resonating to a certain toxin, and you have a certain testing device, we know that you actually have accumulated that toxin. There's another system that's very important, that's actually a basic tool that we use here, is the Ondamed. The Ondamed is the most innovative biophysical system on the world, and it looks like science fiction. You would scan the patient from top to toe and find out the blocked sites. You could then use neural therapy with procaine, go into those spots and revitalize these tissues, or you use the specific frequencies of the Ondamed that you find out by pulse test. And the frequencies that you find out there with the Ondamed all relate to a certain organ. If you find out, let's say, 260 hertz, it may be the gallbladder frequency, and you know the patient comes here with a cancer, let's say with a prostate cancer, and you have a gallbladder frequency. So that is a strong approach. You know now that you have to treat the bile system, the gallbladder, the bile system, in order to get to the disbalanced prostate metabolism.
And now we're back in America.
The way the patients are being treated with chemotherapeutic agents, it's usually a standard way of treatment. What I say is a cookbook. The oncologist looks at the kind of the cancer, the pathology, the grade of your cancer, and they choose the oncology treatments for you and the chemotherapeutic agents for you. But not every patient with breast cancer is going to be responding the same to the breast cancer treatment for chemotherapy agents. Not all the prostate cancers are going to behave the same, and not other cancers. So we have to know what specific cancers are going to be responding to what specific drugs. And the best way to do that is going to be doing through the chemosensitivity. So we have to draw the patient's blood and send them to Germany to a molecular oncologist to check the blood of the cancer patients.
If we find these cells, they want a recommendation what to do. What's the best therapy now in this point, in this time point?
People send blood to you from America. How does it work?
We got the sample from the patient, and we isolate from this blood the tumor cells. And then we do a molecular characterization so that we can say it's a typical tumor cell from, for example, breast cancer, ovarian cancer, colon cancer. So we can say if the primary tumor is no, if this is a cell which comes really from the primary tumor, it's really a disseminated tumor cells. And for the chemosensitivity testing, we look for special drug targets in these cells. And if we have all this information, we can say what kind of cytotoxic compound would work or not. So we can recommend to the doctors what's the best therapy.
At least we have seen the proof outside their body in the laboratory that their kind of cancer was sensitive to the kind of chemotherapy that was tested.
The tumor cell changes all the time, and we have to adapt our therapy to the characteristic of these tumor cells. And that means really highly individualized. That's the reason why many patients with a standard scheme have no success.
I use Asira because it is based on quantum physics theory. What it does, it helps us to double check on whatever we have done. For example, if we have done the chemosensitivity and we have sent the blood to Germany, we are waiting for the results to come back, and when we have it, I could double check with the Asira to see if the body shows good response to that. And a lot of times we see they match. In other words, what we get from German, it happens that the Asira shows, yes, that is a good chemotherapy, for example, or it's a good natural treatment for the patients who are going through treatment. The first person the patients will see, obviously, is me. They're going to see me for admission and do a physical examination and my interview with them. They will go for lymphatic drainage massage therapy, and they start their days every single day, 5 days a week with that. So with this lymphatic drainage, they will benefit to get rid of the toxic material, as well as it's going to relax them, because while they're getting their lymphatic drainage in a nice quiet room, they're listening to a beautiful music, and at the end they will get some reflexology treatment. After that, they go use the infrared sauna. It is a big sauna, but every patient is going to have their time. Every single person is going to have a different kind of IVs. It depends on their kidney function, liver function, what other things we got to add to their vitamin C, how much of vitamin C they could tolerate, and those are going to be tailored on daily basis. And we have a microwave heat system which is being used for the patients who have lower back pain and lower back metastasis and all those things. It helps them with the pain tremendously. Undermed is a German equipment. It works, the mechanism of action is to work on blockages. Any kind of blockages there is in the body, emotional or physical, it will detect it. And not only it will detect the blockages, it will help that to come back to normal. In other words, it does have a balancing function.
This is Mr. Donald Wood, who has cancer of prostate and came to me with metastatic stage 4, very aggressive cancer about a year, 7-8 months ago.
The fourth biopsy in January 2008 was positive. My PSA has been 83.5, and eventually it reached 380. When I later saw an oncologist, I asked him how long he thinks I had to live. He told me probably 3 to 6 months, maybe a year, and that surgery was no longer an option. My first treatments was for 4 consecutive 5 days periods, I was started on a protocol of vitamins and minerals by Dr. Ferry, by IVs and orally, to strengthen my immune system and rid my body of toxins. Started showing improvements immediately, and after several series of treatments, following the diet and supplement regime, etc., my PSA was reduced to 7.4. The improvements have continued, and I am able to live a basically normal, healthy life of a 76-year-old man. My life is worth living again, and I feel great.
We help them here with different approaches. And when they understand that you boost your immune system, your own body is going to be fighting with your own cancer, that immediately brings hope in their hearts.
I lost a sister to breast cancer because she chose to go orthodox medicine and do exactly what they told her. I lost a brother to leukemia. I have two other brothers who are fighting. One has prostate.
And they won't listen to you.
They will not.
Here they are, they see
me,
incredible results.
They say what I do is too hard.
I have seen a lot of patients that when you see that will is gone, the will to live is gone, they deteriorate and their cancer takes them. But I have seen the opposite, that when they boost their spiritual aspect and their willpower, that they want to battle, they want to kill the cancer, they leave even the strongest kind of cancer, and they really, a lot of times they fight, and they have become winners, and they have won the cancer.
I know that my sister and my brother have both
ready to check out.
Yes, my sister was definitely ready to check out. She had no will to fight. I said when I was diagnosed in 1983, he told me I would be dead in 3 weeks, the doctor that diagnosed me.
Oh, really?
And I said, like hell I will.
There is something called samarium. This is a radioisotope that is injected once, and it selectively goes and attacks cancer cells and destroy cancer cells. And not only that, also it strengthens the bones and regenerate. And more importantly, within 2 or 3 days, we have seen our patients get rid of pain that they've been suffering for several months due to the bone cancer. So we can see remission, full remission in bone metastases within 4, 6, 8 weeks with the use of samarium.
Let's review the pie chart now, Burton. We talked about chemotherapy alone. No more than a 20% long-term survival rate, remission rate, and this would include complete remissions, partial remissions, stable disease type of findings. Then if we add a good homeopathic supplement, a natural substance such as poly-MVA, such as the ones we're working on now, such as and homeopathics with good supplements, good vitamin supplements, immune-building supplements, we're talking about over a 50% response rate. Now, we're not going to talk about chemotherapy twice, so let's just take the 50% and then add to that hormonal therapies, which may add 10%, immune and vaccine therapies, which would add another 10%, and then diet and nutrition therapies, which would add another 10 to 15%. All in all, we're never going to hit 100% with cancer. We're never going to hit the grand slam out of the park every time, but we're getting very close. We're getting into the 85–90% group.
And that's for end-stage cancers.
These are for advanced end-stage cancers, yes. We're really bringing together everything in the armamentarium. We're using all our weaponry. We're using the smart bombs, we're using the tanks, we're using the ground troops, we're using the Humvees.
And the patient isn't losing their hair and vomiting.
That's the beauty of integrated therapy, Burton, is we're not seeing these horrendous toxic side effects. For instance, we know the toxic side effects with chemotherapy. They start at the top with toxic brain syndrome, which is basically brain fog, which happens after chemotherapy. Then we have hearing and visual problems from chemotherapy. We have, in the mouth, we have stomatitis, raw ulcers. We have candidiasis, which can go all the way through from the mouth down to the anus. We have diarrheas. We have esophageal erosions. We have cardiac problems from the anthracycline drugs, the adriamycins, the mitoxanthrones, and the doxils. We have lung problems from the bleomycins and from the mitomycin Cs. We have liver toxicity from adriamycin, from methotrexate, from 5-FU, from many of the other antimetabolites. And then you have pancreatic problems. You have muscle problems, muscle wasting, anorexia. And ultimately, you have death from chemotherapy, whereas the cancer may be gone, but the patient is dead. What have you accomplished here?
It's nice to be able to do as Germans do. Germans do electrodermal screening on chemotherapy agents to see which ones will benefit the patient most. So that's very helpful. Another German invention is dark field microscopy, and also the live cell therapy, or the dried, looking at dried blood under a microscope. And from this you can get a really good idea of who has a lot of free radical damage. Now there's lots of blood tests that you can tell about free radical damage that, you know, cancers are very dirty. They put out really, and so are infections. They put out a lot of free radicals, and you can really see this free radical damage under the microscope. And you can see nutritional deficiencies. You can see folic acid deficiencies. You can see fatty acid deficiencies. All these are very clear under the microscope. You can tell if people have a lot of fibrin, which is the stuff that plugs up the blood vessels. You can see all these quite readily. And if somebody hasn't had the heart attack or the stroke or the cancer, you can say, heavenly days, we need to do some work here. This is not normal looking blood.
This sample here is from a patient with breast cancer. You'll notice in this slide, for instance, there is a crystallization going on of red blood cells. This is a typical red blood cell. This is a red blood cell in the process of degeneration. And these are crystallizations that are occurring up here, in here, over here.
And what does that mean?
And here. Well, this is a fingerprint of cancer. But I've been observing this clinically for 15, 20 years. And what I'm interested in are patterns that occur over time. This is a live sample here of a patient who had breast cancer 7 years ago. And of course, when I look with a mind towards understanding how viable the cells are. This is a neutrophil, for instance.
Now, this is just from one prick of the finger.
Yeah.
And a drop of blood.
The small drop of blood is reflecting the whole picture of the body. And when this was a large spore form, this being a red blood cell, and this spore was present in a patient who I already knew had cancer, so I don't use these for diagnosing, but I use them for tracking. And I start reading this as information about the cancer itself. Cancer needs to build an infrastructure to grow into, and it puts out these little rootlets and grows into it, and it's very vulnerable. And that's why hyperthermia or high heat therapy is combined with low-dose chemotherapy in very advanced cases to try to save the patient by not killing the cancer and killing the patient oftentimes, but regulating the ability of the cancer to grow and simultaneously rebuilding the immune system of the person, detoxifying and allowing them to fight the cancer on their own.
There is a stranglehold by the American Cancer Society, the National Cancer Institutes, all the official cancer societies, the surgical ones, the medical ones, the medical oncology groups, ASCO, the American Society of Clinical Oncology. There's very little presented at their meetings on natural therapies. Even
Pay no attention
even
to
for
the immune system.
poster sessions, they don't go into it.
2 years ago, I gave a report to the NCI Board of Directors in Rockwell, Maryland. And I remember they were sitting very...
The FDA in Maryland.
Yeah, but it was the National Cancer Institute.
Oh, I see.
They were sitting a couple of very illustrious people from NCI. And I gave, as I do it often, a very normal report of what data we have. And at the end, the chairman of the directors said, well, if that is true, that is going to be a revolution in oncology. I went back to Germany. but I have thought that over very often. Here you have individual people like Dr. Scheller, whomever, who are very much in front of oncology. But these are a few clinics, a few people. What we need is major clinical institutions in the United States. I would even like, under the umbrella of NCI, to make it very official. They should test the system, try to treat after pharmacogenomic data in disseminated cancer cell, or leave it and observe what happens to the patients.
There are many diseases that don't have to be deadly, but if you're limited to only using chemo, only following the protocol that has been designed 10 years ago or 5 years ago for 2% of the patients, you're not reaching them.
And there's a single-mindedness that I was referring to earlier in medicine, which has to do with simply focusing on the cancer, not on the person. And in the process, losing the person as well as killing the cancer.
So you treat the person who has the cancer.
Yeah,
not
it's
the
a lot
cancer
more
itself.
work. Yeah, it's a lot more work.
Conventional medicine doesn't know about it because they are not taught. And one thing for sure, people want to stay blind for their ego, for their image. Just they want to flow in the mainstream medicine. But if you become a patient yourself, that's the time, not later than that, that you start thinking.
That's how you got into this integrative
Exactly, because I'm a patient myself, and I cannot understand that there was no answer to my problems.
Most traditionally trained oncologists are very narrowly focused. They see a direct path to the treatment protocols, and they're unwilling to accept any alternative therapies from any side. Many times an oncologist, if a patient comes in and tells them they want to be on a certain diet or supplements, they will often turn them away or roll their eyes and leave the room, and they treat them very poorly and they don't respect their wishes.
Well, this medicine could be practiced anywhere in the world if people would open up their minds and learn and look at the data and see the results that we're getting. The problem is that many, many of our colleagues are so skeptical and so close-minded that they don't wish to even look at the data for confirmation. And unfortunately, there are many, many people out there in the world who are utilizing cancer patients, for example, just for profit. They are not there to help them, and we are there to help them, but how do you differentiate?
Why don't they do this in the United States?
In many countries, patients with metastasis, nobody's interested in, because you cannot get a big success. For example, if you have a breast cancer and you want to cure the patient for the first treatment, this is okay. But in the metastatic patients, doctors are not so interested in.
Right now it's available here in Frankfurt.
And Frankfurt is an international place, so
it's easy to get to.
It's easy to get there, and thanks to our good cooperation to a lot of American sites and oncologists. And interestingly, most of the patients are finding to us via internet.
When we declared war on cancer in 1972, it is very characteristic of the culture to declare war on something if you don't like it. And basically, it doesn't work with cancer. I would contend it works in a small percentage of cases. That philosophy has gotten us nowhere but killing a lot of patients. Because it's oriented towards selling a lot of chemicals rather than curing patients.
We know, if nothing else, from the AIDS epidemic, that cancer is caused by a dysfunctional immune system. And this became abundantly clear in the early 80s when we saw these young people dying, especially young men, with all these horrible types of cancer, when ordinarily these cancers were never seen in this population age group. So studies from the 80s and onward, and even before that, have shown that the immune system is vitally important to fighting cancer and keeping the body's defenses at a strong level.
It's not taught in medical school, is it?
No, I went to the University of California, San Francisco, one of the top 10 medical schools, and we heard nothing about this concept as far as I can recall in 4 years of medical school.
And in all the years since you've been out of there, which is 30 years, they haven't, and we've learned so much, they haven't done anything about it. Why? What do you think is going on in these oncologists' mind?
I think there are several things. For one thing, because they haven't been taught about it in medical school, they're afraid of it. They don't think it's real. They don't. The terms you get are it's not scientific. It's never been scientifically proven. It's not true science. It's never been subjected to a controlled scientific study.
That's
you get
interesting.
all this verbiage.
The oncologists didn't believe that immunology and immune cells had a major role in prevention of cancer or treatment of cancer.
When a doctor, oncologist sees their patient, many times their experience with cancer is they're going to die. Matter of fact, they're framing it, and many times will tell people you've got 3 months to live.
Cancer is, unfortunately, a disease of victims. And the victims tend not to scream to high heaven if they're not getting their treatment. It's like, shut up, take it, and die.
I mean, for them to tell you that you have this and you know, we'll give you a few months, but we'll try and make it a longer few months if you take this, and that's what they can offer you. And people say, well, I guess I'm lucky to live a few more months, and they buy it because they have no choices. And you want to trust your doctor. That's why it perpetuates, is because you have to trust that somewhere they're going to put together something to save you. They've done it before.
Most people think, well, if it was any good, my doctor would know about it.
Right.
That's not so.
Yeah, and you're a good person, and your doctor's going to try really hard because you deserve to live. But then it becomes the routine of what they can give you legally, you know, without losing their license.
I almost think it equates to murder, the way some of the patients are left go. I experienced it with my own dad. I experienced it with my brother's wife and many family members. When you become 4th stage terminal cancer, it seems like they give such excesses of chemo and radiation that alone is enough to kill you. Very few people survive. I have found statistically that in our local northern New Jersey metropolitan hospitals that it's only between 5 and 10% tops that will survive. Of end-stage cancer.
Can cure cancer utilizing conventional medicine and alternative medicine in combinations and in ways that we never dreamed possible before, where every single substance plays a role in curing the patients of their cancers, in eliminating all of the toxins, all of the side effects. The conventional medicine is enhanced, but we are selective with it. We are using it in a way that is defined just for the patient's specific therapy.
I made this documentary so I could share the information that I have learned over the last 30 years on the causes of cancer and how cancer can successfully be reversed. Once you have cancer, you must stay on top of it. You can never give up. Treatment has to be specific for your cancer, and the tests that are available today that will target your cancer cells, either with chemotherapy or natural substances, is the difference of success or failure. I'm a consultant, and I'm available to guide you in the reversal of this dreaded disease.
So what that is the only clinic which is left in Mexico now? Oh, I thought that they out because I had breast cancer about 17 years ago without any chemo. Yeah, I mean I had my breast cancer about 17 years ago without chemo. So I knew what that time mostly is going on, and there were several clinics, but swelling was kicked off already. I was in Southern California.
Floyd, will you take a look at the questions that have come in the chat box and respond to them?
Great.
And sincerity in painting, and that it's something that we can feel and sense when we look deeply into a painting. So I've just been
My computer just went out, but I will come back on in a moment.
Holistic skills, it's just much. So no, I mean I refuse chemo.
I'll be back in a minute.
Otherwise, I wouldn't be here even. Somehow, just surgery. Yeah, surgery and detox. I had the whole my system of detox.
Yeah, my computer keeps freezing for some reason. I'm just restarting my computer. But everybody's still here.
I know
They'll come
about
back on.
clinics. So how
I'm so
many
dominant.
clinics in Mexico now?
Like all my people.
With all of this, Dr. Munoz, he is Mexican doctor. He's licensed in Mexico, right? Well, he's still there.
Close to the microphone. Yes, I think he's still there.
We'll be back on
and
with
some
you in
of the
just a minute. I'm
things-
just restarting my computer.
You have a lot
Right.
of other people who want to have something here, me.
Right.
Yeah, so my question is, can you ask?
Okay, so-
Yeah, so, yeah, it was one clinic in Mexico, because I know that 15 years ago, they were closed, it out, and it's really returned to the US, practicing in Orange County. You know, like, so, and there are several.
We're talking without naming a clinic, so it's not really easy.
It's
Muted. Introduction. I've been to the clinic. I think
Yeah, no, there are other clinics, no, I think Dr. Taub knows about this.
So we have
recording in progress.
Yeah, turn off your audio.
Yeah.
Quote, what's the use? Question mark. End of quote. The affirmation is, I lovingly forgive and release all of the past. Period. I choose to fill my world with joy. Period. I love and approve of myself. Period.
here, right here, right here. Right.
Cancer. In Louise Hay's book, You Can Heal Your Life, page 158.
Hello?
Section list at the end of the book, at least in the paperback edition. Deep hurt, long-standing resentment, deep secret or grief eating away at the self, carrying hatred. In quotes, what's the use? Affirmation. I lovingly forgive and release all of the past. I choose to fill my world with joy. I love and approve of myself.
Okay.
phone without feedback. Okay, so maybe I can now. Great. So yours seems to be off and mine is on. So I can try to answer some questions.
Laura, you can just sit next to him and.
Okay,
Or
so I
next
can
to-
quickly answer the question about link. Lori has a few copies of this. The video, I don't believe, is available on the internet.
Yeah, I actually,
Um,
I've made copies and you can't get it on Amazon. Of the whole movie?
Right.
What? Of the whole movie.
So
I have
there-
copies of the whole movie.
Yeah, for the whole movie.
So one of the things that many of the talks featured was the immune system. And several of the doctors talked about it. There is now a great deal of interest in conventional medicine of growing immune system cells, not just dendritic cells, but T cells. Also, they call them tumor infiltrating lymphocytes, doing all of this outside the body. Personally, I'm a believer of stimulating the immune system inside the body. Some of the vaccines do that, and the beta-allothine drug that I mentioned does that. So I think it's very important to stimulate the immune system, and that is something that in the decades since the film was made has been much more broadly accepted. So the using nanoparticles still remains highly experimental. We'll work in some small animal systems, and various ones have been tried in people. They continue to try them in people. That there was a publication on that system that was briefly featured in the film in 2011. And although they could heat the tumors, the actual clinical results weren't as remarkable as they hoped. So people have still been working to pursue those. So my computer doesn't show the earlier questions. So people, if you'll resubmit your, because my computer was off for a while, if you resubmit your questions or in chat or ask them,
Yeah.
I'd be happy to answer them or see what I can do to address them.
No, I lost.
I can address a bunch of things that were dealt with. Micrometastases and cancer cells in the blood have been an area of great interest. Unfortunately, it's an area that's only relevant to people with advanced cancer, with very advanced cancer, because there simply are not that many cells in the blood. In 10 mils of blood, there may or may not be a single cell. So in most stages of cancer for most people. However, things that are shed from the cancer can be readily detected. And this is both cancer DNA and little fragments of cells called exosomes are now being studied very widely. They don't have a nucleus. They do have a little bit, fragments of DNA from the cell cytoplasm, and they do have properties of the cells, but they don't grow since they don't have a nucleus. There's been a resurgence in, what the conventional people are now calling functional medicine, meaning looking at the ability of cancer drugs to kill cancer cells in culture. And a few use cells isolated from the blood, but those are few and far between. Some use little pieces of tumor. Some use cells that are liberated from the tumor by dissolving it. Some use slices of tumor. And there's now a Society of Functional Medicine that is part of the conventional groups as opposed to previous functional societies that were alternative that is looking at this.
Is it the same as IFM, the Institute of Functional Medicine?
No, it's the Society of Functional Medicine. I wore the T-shirt yesterday, and it's a different group. And this was actually one of the most heated conversations that I've heard at a conventional medical conference, because after some of the presentations about using various cells to see what the sensitivity was, one person who had been in the alternative community for many years came up and said, yeah, we've been doing this for a long time. And he kind of a little bit went into a rant and until he was asked if, he had a specific question, and he said, why didn't you pay attention to us a decade or more ago?
Oh, interesting.
Yeah.
Did you know the person?
No, I did not recognize them. And then another person who was familiar with the old literature did note that it had been published and ignored, a decade before, that you could double the rate of response using these kinds of tests. Now, what that means is highly dependent on what the starting rate is. If the starting rate is 40%, doubling to 80% is great. If the starting rate is 4%, doubling to 8% is not so remarkable. And so people are still working on that. It's still very difficult. And because the metastases that are in the blood are truly different than the primary cancer, as pointed out here, and there are so few cells, it is very hard to grow them directly with the chemo agents. However, it's become a standard part of conventional medicine to look to see what mutations are present in the blood. They call it liquid biopsy, and sometimes in the single cells that circulate, to see whether they might be treatable with some of the new drugs that target mutations. So a series of these things has been, taken to heart, but not all of them. Some of them have been tested more thoroughly, and at least as individual therapies have not been so successful. It was pointed out that IPT chemo was in many clinics combined with hypothermia, may not be as successful on its own. And also, IPT has a lot of different definitions from a lot of people. Sometimes it is depriving the cells of glucose and keeping the patients in a hypoglucose state for a while so that the chemo can be more effective. Sometimes they actually give glucose with the insulin, which actually pushes more glucose into the cells. And there's
It's very bad because cancer cells thrive on sugar.
That's right. And there's an argument that somehow the glucose carries along the anti-cancer drugs.
Yeah, that's what I
But
thought. That's like he said, glucose.
The actual data on
the
that
drug,
is weak. There is good data that some cancer cells in culture are extremely dependent on, glucose, and IPT kind of works on them in culture, but it's only some of the cancer cells. And it's very, again, individual. Each patient is different.
I got off on sugars this time.
Right, and that's why, Kathleen, I think I gave you some handouts. For the people who are here, you can give them that.
Did you see all the questions coming in?
I will look back.
Yeah,
Thank
a
you.
lot. There's definitely there's quite a few questions that come in.
Wonderful. Would you like to read some, or I will get back to the Zoom?
So, for example, there's a question about what is your take on extended water fasting, urine therapy, stem cells, and exosomes for healing cancer?
Okay. I think dehydration is not a good thing, personally. And some of the things that mentioned, are not, there really aren't any studies on, and don't seem to me to be intuitively beneficial. On the other hand, it is very clear that exosomes are a window into the cancer. And so by analyzing the exosomes, you can learn much about the cancer. And exosomes actually are used by cancer cells to help create a niche they can metastasize to. So that's a great question. Thank you very much.
There's also a question about, since this film is so old, came out in 2006, how much of it is relevant and what's new since then that you could update, that you haven't already.
Right, I began to
Speak to that too.
go ahead, Lori.
Yeah. So,
You might want to come over here so the microphone can pick up the okay. So I think the individual testing of cells, the use of their DNA to choose therapies, and the immune system have been well taken up. And there's now a whole takeover by Gates Institute and drug companies of making modified immune cells that they charge hundreds of thousands of dollars for to help stimulate. And I think things like the beta alanine and making vaccines that are less expensive would be helpful. So I'm just trying to fill up some space. Lori, take it over.
I'm a little chilly, sorry. So am I actually looking at people? I guess.
Maybe move the camera.
Yeah,
I
yeah.
can see you. Very
So I just wanted to say that when I have gone down several times, I've been connected with Dr. Munoz's clinic, and I have his I put the homepage. I sent it to you, and maybe you could show it. Yeah.
Dr. Menoz's clinic.
Dr. Munoz's is the San Diego clinic. And first of all, I want to say something that I noticed. They were talking a little bit about the psychology of the healing community, and when I went down there, I saw that people are very connected and healing together. There's an IV room. They talk to each other. They have a whole variety of different IVs that they use, zinc, selenium, different things, and there's something about a sense of family and connection, and where everybody's encouraging each other, that is very different than I find in some of the clinical places here.
So if you go to the computer, you'll see that I have pulled up that page.
Good. Yeah. Well, you don't have the other pages. So I went and I mean, I've always felt that if I get cancer, I'm going down to Munoz's clinic, and actually, could someone bring those pages over there? I didn't grab them.
Do you still want this up on the screen?
Which one?
Take a look, if you can be looking at the computer.
Yeah, no, I see that.
So do you want that still up, or do you want the folks to be on you?
Well, I think it's fine.
Something about San Diego.
Well, what I'm wanting to, I'm showing the home page, okay? And I just wanted to say that what I observed is they do work with a whole variety of immune therapies. Also, if somebody has cancer, they can get a 1-hour consultation with Munoz. He also works with a variety of vaccines to stimulate and lead to tumor cell apoptosis, which means death, and the important role of NK cells in tumor immunosurveillance within the liver microenvironment makes it tissue specific, and different things. What I like is it's a very active clinic, and there's a lot of freedom to explore. And actually, Floyd has considered going down and offering your test, as I understand it. Is that correct? Or
Yeah, all these systems that look for the growth, the doctors that are interested in testing to see what therapy might work, I think are also partners to use the Therascape test to actually test it 1 month to see if it is working.
Yeah.
Because as they point out, they have a lot of, arrows in their quiver. And it is very hard to know which one to use in a patient.
Yeah.
And, I think this can provide some actual measure of cancer DNA in the blood that can help with that.
Yes, definitely. And so what is true about Dr. Munoz's clinic? They use hyperthermia and whole body hyperthermia. When you go home after being at the clinic, they give you a home treatment, which can include a sauna usually every day. And that's how they control some of the costs because they're not paid for by insurance. Now, one of the things that you brought out, I just want to mention, I was excited to hear that, well, I don't know if a lending group would give any money to a place outside of America, probably. I don't know.
No idea.
Yeah, well, it's an interesting idea.
I think it just depends on credit score and whether they think they'll get paid back.
Yeah.
That's the only thing the lending groups care about.
Yeah.
Now, an interesting thing has happened in the US in the regulation of cancer therapy.
Do you want to come
Right.
to some of the
Right.
camera with me?
Just speaking. Hi, Larry. So in the US, there's now a new level of regulation that did not exist when the movie was made. When the movie was made, the FDA was the only regulatory body. Now the people that control reimbursement are functionally a gatekeeper because the drugs and the processes have become so expensive that unless they're reimbursed, most people can't get them. Most people with cancer are on Medicare because they're older, not exclusively, but there's a big population there. And so if the Medicare authorities, CMS they call it, does not say they're going to reimburse, a therapy never gets picked up. And so it's an added regulatory hurdle.
What I was looking at is some of the lending banks that loan some money for cancer care or not cancer care, you could call it immunological support. You could do it that way because that is an issue is that a lot of these very creative therapies require some money that an insurance company won't pay for.
That's right. And it's also with these artificially made cells that come from the patient's own immune cells that the conventional world is accepting are phenomenally expensive therapies, hundreds of thousands. And so even in the conventional world, there's a big issue of who's going to pay for these and how can they be paid for. And the medicine reaching all levels of society.
So just one more thing about Marty. I helped somebody in 2010 go to the Munoz Clinic. She was stage 4. I brought her from Marin General Hospital and took her down and flew her down and then agreed to take care of her 4 quadruplets that were 10 years old. The father was in prison, and when he got out, he kidnapped them from me when I brought them down to visit. And then the mother ended up going down to be with her children and then died later. Okay. But I want to say when she came back from Munoz's clinic, she had all her full hair. She was energetic. She was smiling. The thing that was terrible for her was the kidnapping of her children who were with us. We all sat and ate dinner. She did not look like a cancer patient. And I'd gotten her from the hospital with a fulminating infection in her breast, which they took care of because she didn't want to have her breast taken off, no surgery. And I didn't agree with that, but I wanted to help. And so I would still appreciate this system. And she was at my house and we were doing the insulin potentiated therapy. It wasn't that difficult to do. And she definitely thrived on it. But when her children were kidnapped from her, I mean, that was terrible. Okay. So So, but I'm just saying that it was very refreshing. Also, when you go to a cancer or oncology clinic here, the very first thing they ask to see is your insurance card. Very first thing. And when I went there, it was such a warm place, you know, where they talk to you first about, well, let's take a look at you, you know, this kind of thing. See what we could do for you. And they talked to me later about how I was going to help support her. Okay. And there was a picture of Mother Mary on the wall, you know, and just a sense of the spiritual beauty that I didn't find. Now, the dentist was right next door. And that's where I learned about the incredible importance of oral care. So, and I'm actually going to be presenting on that in June with my dental hygienist. And I go to an ozone dentist. But I do want to say to you that I did finally look up. I looked up the San Diego clinic, and it's still active, which is wonderful. And they do insulin potentiated therapy. They do the genetic typing. They may not have to send the cells all the way to Germany anymore. Another man a doctor that I've worked with on different issues, Avi Perskowitz, runs a cancer center in San Francisco, and he sends his cells. And I was working with another person who actually has died. The woman who there's another woman who had ovarian cancer, and she did the full program with Minos, and she's completely cancer free for many, many years now. You know, so as I said, this is where I would want to be. Now, I did find a place in Arizona called Oasis of Healing, a holistic cancer treatment center providing alternative and integrative cancer care. And they what?
I think they are in Scottsdale.
No, they were
Phoenix. Phone number 480.
Yeah, but it's not specifically Scottsdale. It's right nearby.
Oh, I mean, Phoenix area.
Nearby, yeah, exactly. And you know, some of the things that they offer, which I really like, is they talk about you have to stop making cancer therapy. They also work with something known as metabolic therapy. And there are ways that you can begin to reduce cancer in your body with what you choose to eat. So.
Can I read some questions to you, please, Lori?
Yeah.
So there's a question about the expense of Dr. Muñoz's clinic, and also if the clinic teaches urine therapy.
Urine therapy? No, I think that's the one in Texas more that does that, Bersinski. But so when I was looking over Mary's therapy, it was about $6,000 a week, but they give an estimate ahead of time. And so Mary spent her money on that, and then she did a she did home treatment later. For about the same.
Is the use of affirmations. Like a lot of people are asking about Louise Hay and the use of affirmations, and what you and Floyd think about that.
I think any kind of psychological. You may be looking. I think any kind of psychological help is wonderful, and if affirmations really make you excited and you really get behind it, I think it's a wonderful thing. Prayer, I think, is also good. You're coming up and you look like you and family support, love.
There's
Also useful.
There's definitely a mind-body connection here. The immune system and the brain are very closely related. They share some things, and so aligning the brain with aligns the immune system to be more effective. It's one of the reasons I'm excited about the Therascape project that measures the DNA in the blood, because if you can tell a person, on a monthly basis, yes, the therapy is working, that helps keep up their spirit. Keep up their whole family spirits and encourages everyone, which, has a spiraling effect with making the therapy more effective.
Exactly.
So there's a question.
Oh, yes, Scott.
Question from Drina Joy in Ecuador wanting to know if the cancer diagnostic test can be done from Eastern Europe and South America, and again, what the cost is.
Well, Avi Herskowitz is the one that I know locally here who takes the test and sends it to Germany.
So, but people in Eastern Europe or South America how do they get the tests?
They would need to call the clinic, and people in South America or Eastern Europe, it'll definitely be less expensive than shipping it from America.
We have somebody from Ecuador who's asking that question right now.
Mm-hmm.
Her name is Drina Joy.
Yeah. I would suggest getting in touch with the clinic directly, and all of these clinics are still alive and well here.
Okay.
The American clinics are the ones that have, the biggest struggle.
Another question is Therascape an equivalent to the Greek RGCC test, where they measure circulating tumor cells? So
no, it's a different.
Only one complete whole tumor cell might be in 10 mils of blood, but there's millions to billions of molecules of DNA. So what we do is we analyze the DNA because that's more sensitive and it's less subject to random variation. Because that in some, mils of blood that might be tested, just randomly, there could be 1, 3, 5, or 0. And there's no mathematical difference. It's just randomness. So the CTC tests are very subject to this problem of sampling, except in very late stage people where there may be more. Even in those cases, it's only 10 per, 10 mils of blood. So we get around that problem by testing for the DNA molecules rather than looking for whole cells.
That's really great. So which company is that? And is that the one that's extremely expensive?
Well, we use, that company is called AI Gene for actionable information. And the test actually will end up being a very inexpensive test because we use an electrode analogous to a glucose meter that uses a simple test strip. Those are actually electrodes. And so the doctor will be able to very easily measure if the therapy is working, on a every visit kind of basis. There's a very interesting, the bowhead whales, who are one of the largest and longest living mammals, do not get cancer, even if the cancer is experimentally induced into the cells of the whale, because their genome contains mutations that help prevent DNA from being damaged, therefore protecting the whales from cancer. Is that
That's wonderful? No, I
think it's sharks. Same thing with sharks.
Well, sharks are said not to get cancer. It turns out sharks do get cancer. I don't know about bowhead whales, but likely these are relative things. And it is very important that the body does contain enzymes that correct mutations. And sometimes they do it accurately and sometimes inaccurately. And there's a very interesting phenomenon about that, that conventional medicine doesn't seem to grasp, and conventional regulatory authorities don't grasp. Our bodies, when they're exposed to something that can be damaging, including UV radiation from the sun and other things, or natural radiation that occurs, that excites them to produce these enzymes that correct the DNA damage. And in fact, if you take cells that have not been exposed to any radiation, they're very sensitive to radiation damage. If you expose them to a tiny amounts of radiation, it induces their enzymes, and that will protect them from subsequent radiation. So the theory that you hear often that if a large dose of radiation is dangerous, a small dose is also dangerous, is actually not borne out by the experiments. And you can think of it, and people say, well, that's weird. And I say, it's not weird at all. I learned that when I was first old enough to put a chair in front of the refrigerator and open the freezer and get to the ice cream. A small dose is beneficial. A large dose, not so much. I relearned it when I could order pizza or drink beer, which I don't do anymore. But it's all, so the small versus large dose is an important thing. And the induction of the natural protective enzymes your body has is very important.
Mhm. Great. I also want to say when I went to the Cancer Update workshop the weekend with A4M, they did go over certain diets that seemed to be helpful more than other diets. And this is borne out in other places, like with brain cancer. A keto diet is very helpful for starting to reduce the tumor. Now with the
alkaline diet.
I'm just telling you what I've learned in that course. The medical with the let me just keep talking with the sex hormone like breast and prostate cancers. They had a diet called the Budwig diet, which was more helpful. Oh, that's nice to see our full faces. I like it much better. And then the other one is the Gerson diet was more helpful with metastatic melanoma, which is what our friend Trevor still has and is doing actually fairly well. So that's a number of years too. That's since 2020. So
that's wonderful. And another question, Scott?
I think we've covered all the, just a reminder to people, if you put a question in much earlier, we lost the earlier chat. So we only have questions that have come in since 9 o'clock.
Mm-hmm.
Lori, or like we're trying to be interested more in this. Have you heard about SACT? So no, I mean the herbs and all that. Yeah, I for example also used it. No, SACT.
You use Theraactive?
No, SACT, like herbs. Yeah, no, in our rainbow they sell it in
You used, if you can talk more slowly and more clearly, I can hear you better.
There is a SAC, no, it's called SACT. No, because of like, yeah, it's an Indian recipe,
right.
Like detox and burdock and all. There's Casey in the like in beginning of 20th century in Chicago was given led by Indians, and she was. Yeah, so it's sold still.
Well, are you referring to SACT?
Yeah, SACT.
Oh, okay. So that how you're pronouncing it.
Yeah. So, how is it kind of like? Is it still believed that it works? Because I mean, for me, it's now important because it's the only thing that I was able to send to my cousins.
I think for some people it works. It's not possible to do anything on a completely wide scale. Everything is individual, and you have to find out how things are working, which is what you say. I believe you.
Maybe like Dr. Taub check it on on this
SACT.
Right. I do not. Yeah, I know of it. I do not know. studies on it. There are sessions at the conventional medical conferences now that have the presentations and posters on alternative medicine things. Now, they don't tend to be highly attended, and in order to get much people to pay much attention on them, because of how conventional medicine thought process works, they have to be just about one thing. So if you're doing a therapy and treating someone with 5 or 8 different things, as most alternative practitioners do, because a person may only respond to one of them, the conventional medicine folks get confused and go, we can't analyze this
I
because there's
agree,
too many
because it's too many
things.
variables, yeah.
So it's very tricky, but there are a whole variety of naturopathic things that are reported on at the conventional societies now.
I want to make sure that we have gotten all the questions.
There's a couple that have just come in. What is your take on using various parts, extracts, and doses of the medical marijuana like THC, CBD, and others, which have helped so many people globally?
I would say I know people who have done that, and what it was called Simpson's oil, and for some people it worked really well.
Rick Simpson.
Simpson,
Yeah, it was based on Rick
Simpson.
Simpson.
Yeah, and then some people it didn't help as well, and they just enjoyed being really stoned.
Well, no, I thought the CDC, the THC, that you don't even feel the buzz.
The CBDs.
I'm just telling you what I observed.
Yeah, many CBDs do not.
I heard you say
Right.
THC.
So many CBDs, the CBDs in general do not have the
Right.
psychoactive effect.
Right.
Well, the THC does.
Yeah.
There's some
definitely.
thought that it potentiates them. Overall, they tend to be immune suppressive. And so, they can be very important symptom relievers, but they do not necessarily have a positive effect on the immune system. And I always tell people who are taking it, they should take something like Torox, and hopefully we'll someday get beta-alanine available so that they stimulate their immune system to compensate for the generally immune suppressive activities and that's why they can be anti-inflammatory and can help with sore, joints and things like that. Well, that's the opposite of what you generally want in cancer, but they are anti-emetic, so that can be very helpful, for cancer patients.
And
So
some of
I'd
the
like to
terpenes are
respond
being,
to.
yeah, I was going to say some of the terpenes in CBD are being researched into their.
Right, they're trying to sort out CBDs. There are a number of different CBDs, and the marijuanas also contain terpenes, and they all can have different effects. There's a lot of different bioactives in the plants, and I don't think we've sorted out and understand which ones are good for what when.
I wanted to mention that the Oasis of Healing clinic in Arizona, I was pretty impressed by them. And so I wanted to find one clinic in America that could do something good and one in Tijuana. And so I printed it out and I gave you the homepage of the Oasis of Healing, Scott. So I'm assuming that you sent that to everybody.
We can send around pictures afterwards.
I'll send it out with the recording tomorrow to everybody.
Thank you.
So there's a question about traditional Chinese medicine. And of course, you can find TCM, especially in San Francisco. There is some concern that many TCM products have been found to be contaminated with some of the
toxic metals.
Yeah. bad things you heard about. And mostly they're not analyzed for them. But so, and that's a whole, another subject that the statistics don't reach me or conventional medicine, so it's very hard to know. And again, a lot of different things are combined, and it's not clear how effective it is. I think that there certainly is a very push towards very conventional medicine in China, and TCM as there has not been so effective that we don't have the, they don't have the same desire and push towards, documenting more conventional things that, and doing clinical trials on them.
Mm-hmm.
I have a question here from the floor, which I think you mentioned something, and I think your pronunciation on it confused me a little bit, but then I realized you were saying exanthones?
Exosomes.
So that's different than XANTHONES? Xanthones?
No.
Xanthones are different.
Okay,
The xanthones are chemicals.
about xanthones, and because I've read
About
about and heard about different
Xango-
stories with xanthones and mangosteen having the pericarp of the mangosteen having a lot of different xanthones that remove free radicals, and I haven't heard any conference about the impact of free radicals or extra hydrogen molecules can help remove free radicals, and if that relates to cancer. And
free radicals cause DNA damage and mutations and are thought to be carcinogenic. And it's thought to be, and antioxidants are thought to be beneficial. Now, there are people who go the opposite route with hydrogen peroxide, which, is, not my common thought is that antioxidants are generally better for people.
When you were talking about these DNA particles, I imagine some of those are the equivalent of the exosomes, right?
So exosomes are tiny things that contain pieces of cell cytoplasm that are membrane bound.
Right.
So you can think of them as mini microcells, but no nucleus. While free DNA also circulates in the blood, it's protected by something called histones that help.
So exosomes, for those of you who are there, are often it was developed and worked with after the initial proposal and discovery of stem cells, and it's seen as the growth factors within stem cells and more stable.
Right. So exosomes can be shed from stem cells.
Right.
And they're also shed from cancer cells.
Mm-hmm.
So it's the same membrane bound packages of cytoplasm, but one comes from, a normal beneficial cell,
right, which we hope,
and one comes from
right,
a stem cell. In fact, it's believed that, the key cells in cancer are cancer stem cells. The big mass of the tumor often is not very dangerous. It's the few stem cells that are the ones that reproduce that are more dangerous.
So Denise Grace seems to want to, she knows a good TCM doctor in Washington, D.C., and people are looking in part for where do I go? Mm-hmm. So would she be willing to share what that is?
She can hear you.
Oh,
Hi.
so Denise.
Everybody can hear you, Lori.
Okay.
Yeah, you can talk
I wasn't clear.
Yeah.
So
Yeah,
Denise, if you know the
So
good
my sister
TCM
had-
doctor in Washington, D.C.,
I don't
that would
remember
be
the
great
name.
to
My
know
sister had
about.
cancer,
There are
and I heard a
some
couple
people who really value Chinese medicine.
Right?
in
Can you hear
particular.
me? Can you hear me?
She's
Hello?
still
Can
there?
you hear me? Can you hear me?
Probably would might take a minute
Can
for
you
her.
can you hear me? Hi, can you hear me?
Yeah, she's
Not-
There she is.
I'm hearing.
Hi, Grace, I'm putting the spotlight on you.
Oh, how embarrassing. All right.
Can you hear me though?
You speak up a little bit.
We should
My
write it down.
disheveled self. Can you
Your
hear
volume
me?
up.
It'll be in the chat and in the recording.
Right. So if you know the name, it might be easiest to put in the chat.
Maybe I
It's
can
a
send it
little hard to
you.
hear you.
This is, I have to look for it. My sister had cancer and passed away, but I did a lot of research.
US has come fourth globally with the highest cancer rates. Oh my God.
Well,
Okay, it looks like you can't hear me.
I can now hear you a little bit.
Is this the great?
Do you have your volume up?
Denise?
To 100%.
This is yours.
Sure, go ahead. Use it. It's okay. So there's a question about cancer rates, and cancer rates need to be age corrected before you can compare them across countries. So countries where people die of other things before they reach the age of 50 always have lower rates than countries that most of the people are older. Right. So yeah, the statistics can be misleading there. So you might ask, what are the rates for people under 50 in both countries? Or what are the rates for any particular age group, in order to get a better understanding of really the what's meaningful there.
Mm-hmm.
There is also, of course, the issue of where are there most chemicals, but each country has its own particular
Set of chemicals.
problem of pollutions, right?
Yes.
And there's no country in the world immune from them.
Right. But I think in America, most really young people don't get cancer as much as older people, right?
Correct. It's highly age dependent. Cancer increases greatly with each year of life.
Probably because, again, if it's environmental, we spend more time being exposed to the environment, and our immune system isn't what it used to be.
Right. The immune system deteriorates, mutations accumulate, although there are as many mutations in cells that aren't cancerous as there are. And what they call epigenetic changes, which is one thing that the Therascape test of the ctDNA measures, can accumulate and be problematic. So a lot of things happen as we age. A lot of them not so good, but the alternative is not so good either.
Is there anybody else who has?
Did she give someone, but this TSM practitioner is somewhere in the East Coast? Yeah.
We don't have the name, but
Yeah, the traditional. She says that you can look up his name, but probably anyone interested can find him also, since he's published and associated with a hospital. So you look up traditional Chinese medicine, and let me finish talking. You look up traditional Chinese medicine in Washington, D.C., and then you scroll down and talk to different doctors to see who's connected with a hospital.
Yeah, because in a couple of acupuncturist office is very good one. One was like bunch of herbs and all. So they just like nothing. If like to cancer, we will do this, like, but like not cancer.
Well, most doctors protect themselves. What I've seen is if you see a doctor and here, to try to address your cancer, because I've helped quite a lot of people, actually more than 4. You sign a document indicating that you're seeing that doctor to improve your immune system. And there's no mention of stopping cancer or reversing it. And does afford some real protection, apparently. So I'm glad.
Right. So someone asked me where I would go and what I would do if I had cancer. And in fact, I did have cancer. And the first thing that I think is critical to do is to research your particular cancer and the therapies that exist for it that have been published on and are easily reimbursed and are conventional. And if your particular cancer is generally cured by, therapies where the statistics are all published, then I would go for that therapy. And I happen to have a leukemia that was generally cured. And we actually analyzed the surface of the cells for additional markers and added another therapy on top of that. And it was a new protocol. But my conventional oncologist from the university hospital was willing to do that. The oncologist that I was first under at Kaiser was not willing to do that.
Typical.
But first research how well conventional medicine works. If you've got something like Steve Jobs had something eminently curable by conventional medicine.
Well, pancreatic cancer is what he had.
No, he had a particular type called islet cell, which is vastly different than the acinar type of pancreatic cancer. And the islet cell tumors are very well treated by conventional medicine. So if he had stayed with the conventional medicine, he probably would have been cured. And on the other hand, if you have a condition that conventional medicine does not cure and gives a lot of side effects to, which may be any late stage cancer, or certain cancers even at the earlier stage, like glioblastoma, conventional medicine has a horrible record with.
That's what my wife does.
Oh, sorry. And there's
very fast, extremely fast.
Extremely fast and, horrible disease.
And also, very exciting things are happening in treating that as a form of metabolic disease. And the University of South Florida is the one that's done the most cutting edge research on that. Specifically, brain to glioblastoma, specifically. And this was also brought up at an anti-aging conference that I attended with a professor named Professor Moran. He was at the University of Pittsburgh. Okay, and he was just amazed to see that this woman who had a brain tumor or glioblastoma in 1/4 of her brain went on this diet of no carbs at all and just all keto, and he showed progressive scans, and it disappeared in her case.
Wow, that's amazing.
So we're always let's all look at discovery.
Yeah, absolutely.
Discovery and individuality and testing and discovery and retesting and then testing the therapies we chose. I think we need to do that, and sometimes clinical trials are useful. When Trevor Miller was left at my house with metastatic melanoma, I took him.
Well, tomorrow will we be able to send out a list of the clinics?
Yeah, I actually had the 2 that I selected, which I thought were particularly good. But if somebody wants a copy of the film, I can make more copies.
Well, I thought the copy was only on DVD.
What?
The movie is only available on DVD.
No, I have them flash drive. I have flash drives.
So you would send a flash drive to people?
Well, I'd like some money for it, but yes.
So explain that.
What?
Do you want to explain that to people?
Yeah, we found a place that can do flash drives. Luckily, I had preserved the movie at my house, and I found it, and I took it to a copy place and made multiple flash drives. and I would sell it for just a little bit above my cost, of course. But you have to reach me specifically, and I can give you my phone number if you're really interested. And we also did a photo of the back of the you know the back of the DVD that has all the names of everybody. But if you get the flash drive, you can take notes on it again and see what people are doing that are active in their field at this time. You know, because a lot of these people are still working. They weren't older ones. So, is that worthwhile? Scott, is that worthwhile?
Yeah, absolutely. So
Okay.
if you're in, well,
So,
What is the title of this movie?
what?
Do they have a-
Cancer Conquest.
And you can't get it on Amazon, it's not on anything.
Thank you so much for doing this.
What?
Thank you.
Yeah,
All right,
good.
yes.
So I can arrange for that, but I will need to get, the best way to reach me is by texting me, and I want to give my number. Okay?
Sure.
415.
Type it in there.
Oh, okay, I could do that.
You
too.
can read.
You know, I don't
say it
get
out loud.
PCs. Maybe I'll screw it up.
Yeah, you hold the T, and I'll type 415.
415-847-5950. And my name is Lori Grace. And you don't have the copy of, could you bring the video back up here? So I also photographed the back that shows all the different doctors. Where is it? See? And I'm willing to photograph that and send it along with the flash drive, because you can't get the DVD cover anymore. Did people generally like the film? I liked it.
I think we got very, very positive comments, yes.
Yeah, good. First, yeah.
But people like Floyd Taub.
Like what?
He's
What?
teasing you. He said they liked me better.
You know? Right, exactly. I think we're all working on this together, you know?
It takes all of us. This
Right.
is a very severe problem.
Right.
And, the conventional medicine folks are, have caught on that the immune system works, but they're going down extremely expensive routes that are going to be, have a lot of toxicity. People have died in the clinical trials.
Right, exactly.
Even of the immune therapies that they're working on, and that are
Right.
incredibly expensive and not going to be available. We all need to work together to get things like the beta allothine and simpler vaccines and stuff.
And natural and supportive natural therapies too.
That's right. It's a little harder to know what molecules are the exact actives in natural therapies, so you can get the right dose. But nevertheless, they're generally not that critical to get the exact right dose, and they can be helpful.
So what they did at Munoz's place, they did vitamin C IVs, zinc, selenium, and then vaccines. They have about 6 or 7 of them.
Right. I think
So-
his vaccines are probably the most important part of his therapy. I have a prejudice towards the immune system, but that's because I know it can non-toxically cure cancer, and the data on many of the other things you mentioned is not as clear. And, as I used to tell people, and as was mentioned in the film, we unfortunately had the experiment done to prove that cancer is related to the immune system when AIDS struck. Now, it wasn't all cancers that were increased, but now the most common cause of AIDS-related death is cancer.
Wow.
Kaposi's sarcoma is the same one?
Kaposi's carcinoma cancer is the most frequent, but it's generally not the most fatal. Lymphoma kills more people.
And there's a big relationship between how much Roundup you have in your body and your likelihood to get non-Hodgkin's lymphoma, at least. That's where we have so many lawsuits out about that.
Yeah.
So basically, immunotherapy is what in this country. I just know how it's another country, some else. So are they available? Is it available like for, or maybe as other not in other countries, it might be available to like people who nothing helps, right? Or it's absolutely practically like nothing.
Immunotherapy is encompasses a lot of things, but right now, over half the people in this country are eligible for immunotherapy as part of conventional medicine. They are they're now very expensive drugs.
The clinical trials, there are lots of clinical trials that are available for free, but it is a clinical trial. And I saw Trevor was helped by it, but it was a lot of side effects.
It's not already a stage of clinical trials, I think.
What?
No, immunotherapy is not trials.
No, they do many.
It's used.
Cancer research is
for healing. No, I know in like in Russia, for example, they are available for free for people like in the fourth stage of cancer. Well, obvious, like nothing is gonna help at all. And then it's like the state pays for it.
Right. There's a big push by the drug companies to make them available earlier. And there are many trials on that. So they are approved. Unfortunately, immunotherapy helps only about a third of the people. It varies from cancer to cancer. In some cancers, it's better than 80%.
Tried already on fourth stage, or
It also depends on stage and many other things. Many times, but overall, it helps about a third of the time and cures only 10% of the people.
Wow.
So there are many trials, and these drugs, there's 4 or 5 of them, sell $10 billion a year. But there are many trials that are combining various immunotherapies and combining immunotherapies with other things to increase the cure rate. So those trials, nobody gets placebo. They get the current best therapy compared to an immunotherapy plus something else. Now that plus something else may make it more effective. In theory, it could also just increase side effects without making it more effective. So it is a trial, but everybody gets, something that is likely to help them. And once you're in a trial, then your costs are covered.
Right. So that's what happened with Trevor. But then we went outside of it because it only took him so far in improvement. So I have found on the Oasis of Healing site, they use metabolic therapies to effectively eliminate cancer when us just understand the biology of cancer. They're lacking in many enzymes that healthy cells have. And they are unable to survive because they can metabolize these metabolic therapies. They cannot metabolize these metabolic therapies, and this exploits the cancer cell's enzymatic limitations. So what happens with going to the Aloha, the Oasis of Healing, is that they also work with curcumin, quercetin, vitamin C, anti-parasitic drugs, repurposed drugs. And,
And remember, Lori, to talk to the audience, to still.
oh, okay, yeah, thank you. And sorry, thank you. Insulin potentiated therapy, vegan low glycemic diet, juice fasting, water, starved cancer. What I do like about this place, and vitamin C, ozone, and hydrogen peroxide, EWAT exercise with oxygen therapy. And so this is this clinic in Arizona. And then artist Sunate exploits cancer's love of iron. That sounds curious. You heard of it?
No, don't know anything about it.
Okay. Well, anyway, I just happen to like the place. It's very a loving, peaceful, beautiful place, not sort of clinical. When I had to take Trevor down to the clinic, the big hospital clinic, it's so impersonal. I'm glad I was there for him.
Mm-hmm.
Yeah.
Yes, it is a problem with
So-
conventional medicine.
Yeah, it
It's
is.
very
And
impersonal.
it needs to be changed. Yeah.
It's after 10 o'clock.
All right. Yes, we're at 10 o'clock. Thank you for lasting as long as you did, everybody. Getting colder and colder. Yes, right, it is. I agree. In fact, I wish I knew how to work the heating here.
Oh, I can certainly do that. Anyway, now we're leaving.
Yeah,
So much.
Do we need to
Thank you
move
so
the chairs
much. And
before we go?
Okay, good. I'm glad you were happy with us. Thank you.
Do we need to put away chairs
Should I say
before we
thank
go?
you?
I think we should, yeah, well, anyway,
Okay,
I
well-
wanted to thank everybody for lasting as long as you have. We had a lot of different things we were saying.
Thank you. Should read the
Thank,
chat box.
right.
Oh, good, great.
Thank you, Scott. Thank you, Lori.
Right, thank you.
Thank you for
And-
all the attendees. Thanks for all the support and love in the chat box.
Yay.
Take care.
Thank you, everybody. We appreciate you. Yes.
So,
Go
Kathleen,
play.
you might be able to help on
Bye-bye,
this.
Laura. Thanks.
So,
I've enjoyed over the leaf. Oh, you are muted.
all right, not muted now.